Hello everyone, and welcome to our favorite channel. Today, I'm going to discuss a topic that might not often be openly talked about, but it's incredibly important for men's health: the relationship between masturbation and prostate health. This episode's title is, "What Happens to a Man's Prostate When He Masturbates Daily?" I'll be approaching this from a medical and scientific perspective, without judgment, because it's a normal part of human life that needs to be properly understood. Before we begin, let's first understand what the prostate is. The prostate is a small walnut-sized gland located below a man's bladder, surrounding the urethra. Its primary function is to produce prostatic fluid, a crucial component of semen. This fluid helps to nourish and protect sperm during their journey to the egg. As men age, the prostate can experience various issues. The most common are benign prostatic hyperplasia, BPH, also known as an enlarged prostate, prostatitis, inflammation of the prostate, and the most feared, prostate cancer. So, the question is, can daily masturbation affect prostate health? Let's start with some common myths. Debunking myths about masturbation and prostate health. Many people believe that excessive masturbation can lead to prostate problems, blindness, or even mental disorders. These are myths that have long been disproven by medical research. In fact, masturbation is a normal and healthy sexual activity when done appropriately. Modern medical research actually shows the opposite. Several studies indicate that routine ejaculation, whether through sexual activity or masturbation, can actually offer benefits for prostate health. Why is this the case? First, let's discuss prostate gland emptying. When a man ejaculates, the prostate gland contracts and expels its fluid. This process helps to clear the prostatic ducts of bacteria and potentially harmful substances. Imagine it like a drainage system that needs regular cleaning to prevent blockages. A study published in the European Urology Journal in 2016 found that men who ejaculated 21 times or more per month had a 20% lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. This research involved nearly 32,000 men followed for 18 years. The biological mechanisms behind this benefit are still being studied, but there are several plausible theories. First, routine ejaculation helps reduce the concentration of carcinogenic substances, cancer-causing agents, in the prostatic fluid. Second, this activity can help reduce chronic inflammation, which can damage prostate cells. Third, ejaculation can help maintain healthy blood circulation in the genital area. However, it's important to remember that routine doesn't mean excessive. Like any other activity, masturbation should be done in moderation and should not interfere with daily activities or social relationships. Now, let's specifically discuss daily masturbation. Is daily masturbation safe? From a medical standpoint, daily masturbation is generally not harmful to prostate health, as long as it's done correctly and hygienically. What needs attention are technique and frequency. Masturbation that is too rough or uses improper techniques can cause irritation or chafing to the genital organs. Cleanliness is also crucial to prevent urinary tract infections or infections of the prostate itself. Some men might worry about prostate fatigue from daily masturbation. This is an unfounded concern. The prostate is an organ designed to continuously produce fluid, and routine ejaculation actually helps maintain its normal function. There is no medical evidence to suggest that daily masturbation can deplete or weaken the prostate. However, there are some conditions where masturbation should be limited or temporarily avoided. For example, if someone is experiencing an acute urinary tract infection, acute prostatitis, or is recovering after prostate surgery. In such cases, it's best to consult a doctor first. It's also important to understand the difference between healthy masturbation and compulsive behavior. Healthy masturbation is done by choice, does not interfere with daily activities, and does not cause physical or emotional distress. If masturbation begins to interfere with work, social relationships, or causes physical injury due to excessive activity, professional help might be needed. Let's also talk about prostatitis, which is inflammation of the prostate. Prostatitis and other factors. There are several types of prostatitis, and some of them can be worsened by excessive sexual activity. However, chronic non-bacterial prostatitis, which is the most common type, can sometimes improve with routine ejaculation because it helps reduce congestion or fluid buildup in the prostate. Symptoms of prostatitis can include pelvic pain, difficulty urinating, or pain during ejaculation. If you experience these symptoms, it's best to consult a urologist for. If this video helped you or reminded you of who you truly are, hit the like button right now, share it with friends, family, or anyone who might quietly need to hear this. And in the comments, tell me which part made you realize the most, or what other topics you'd like me to cover. Don't forget to mention your city or country too. I'm thrilled to see this community of strong men continue to grow. Like, subscribe, take good care of your health, and I'll see you in the next video.